antibiotic resistance could be fueled by something most of us reach for without a second thought: common painkillers. But here's where it gets controversial. Recent research reveals that popular analgesics like ibuprofen and paracetamol might actually be accelerating antimicrobial resistance, especially when taken together. This insight challenges the long-standing belief that only antibiotics contribute to this global health issue. A team of scientists from the University of South Australia dove deep into this phenomenon during a study conducted in residential aged care facilities, RACFs. Their focus was on the interaction between gut bacteria, specifically Escherichia coli, common non-antibiotic medications, and the broad-spectrum antibiotic ciprofloxacin. Associate Professor Riti Venter, who led the research, explained to Australian pharmacists how they carried out their investigation. "We isolated an antibiotic-sensitive bacterium from a resident and then exposed it to 9 medications frequently used by older adults," she said. These drugs included not only ibuprofen and paracetamol, but also diclofenac, furosemide, metformin, atorvastatin, tramadol, temazepam, and pseudoephedrine. They tested each medication individually and also examined the impact when the drugs were paired 2 at a time. What they discovered was striking. Both paracetamol and ibuprofen independently boosted the bacteria's resistance to ciprofloxacin, but when combined, their effect was even more pronounced. The bacteria exposed to ciprofloxacin alongside ibuprofen and paracetamol developed more genetic mutations compared to exposure to the antibiotic alone, a Professor Venter said. These mutations not only made the bacteria grow faster, but also greatly increased their resistance. What adds to the concern is that the resistance wasn't limited to ciprofloxacin. The bacteria also showed heightened resistance to several other antibiotic classes, suggesting a broader threat to treatment effectiveness. So, how exactly do these everyday painkillers fuel this resistance? Follow-up genetic sequencing showed the bacteria mutate in response to stress caused by the combination of these medications. Microbes evolve incredibly fast. Under optimal conditions, some double every 20 minutes, Professor Venter explained. When stressed by both paracetamol and antibiotics, the rate of mutation spikes. While some mutations are detrimental to the bacteria, many can lead to stronger drug resistance. Key mutations involve the development of efflux pumps, which are proteins embedded in bacterial membranes. These pumps act like microscopic bouncers, expelling antibiotics before they can damage the bacteria. When paracetamol and ibuprofen are used together with ciprofloxacin, this synergy accelerates mutation rates, making resistance more likely. On a brighter note, the other 7 medications tested did not contribute to increased antimicrobial resistance, either alone or combined with ibuprofen. None were worse than ibuprofen by itself, noted a Professor Venter. But who is the most vulnerable to these alarming findings? Older adults, especially those in aged care facilities, stand out as high risk. This group often takes multiple medications for different conditions: pain relief, hypertension, sleep issues, which can create a perfect storm for gut bacteria to gain resistance. Older Australians are already known reservoirs for antimicrobial resistance, making this discovery particularly relevant for healthcare strategies in these communities. While these findings don't immediately call for policy changes, a Professor Venter emphasizes the importance of understanding why these drugs are taken together and exploring safer alternatives. "We want to investigate if there's a pain medication that doesn't promote antimicrobial resistance, or if spacing out doses could reduce risks," she said. For pharmacists, this insight offers a powerful opportunity to educate patients. It's common for people to combine antibiotics with over-the-counter painkillers. For example, a woman treating a urinary tract infection with antibiotics might also take paracetamol or ibuprofen for discomfort. Or a child with bacterial tonsillitis might be given azithromycin along with these analgesics to control fever. Many are aware that antibiotics can spark resistance, but few recognize that everyday medicines like paracetamol and ibuprofen can do the same, a Professor Venture remarked. Recent regulatory changes around paracetamol packaging sizes have already begun raising public consciousness about the potential risks of these drugs. According to the Pharmaceutical Society of Australia, PSA, pharmacists play a growing role in guiding safe use of common painkillers, especially since paracetamol has been linked to a significant portion of medicine-related poisonings in young children. By limiting pack sizes, we create opportunities for meaningful conversations about medicine safety in both pharmacies and homes, said PSA National President Associate Professor Fei Sim. She stressed how this balance ensures access to effective pain relief while minimizing misuse and harm. But here's the question that might divide opinion. Should we rethink how we use these ubiquitous medications in everyday healthcare, especially when antibiotics are involved? Could alternative pain management strategies significantly slow down the rise of antimicrobial resistance? Or will such changes complicate pain relief for patients? Share your thoughts. Do you agree with these findings, or do you think the risks are overstated? The discussion is just getting started, and your voice matters.